A 24-year-old Primigravida client has just given birth to a Rh-positive child and she herself is Rh-negative. The nurse recognizes this situation can lead to future problems in terms of future pregnancies due to this blood type mismatch. All of the following are associated with Rh factor incompatibility except dash. A. May lead to fetal anemia and lead to an acceleration of red blood cell production if the mother is not given Rho. D immune globulin to prevent antibodies from destroying fetal blood cells. B. The mother will form IgG and IgM antibodies in response to being exposed to a fetus incompatible blood type. C. A major effect of Rh incompatibility is an increased risk of blood clotting and thrombosis in the fetus during subsequent pregnancies. D. The mixing of fetal blood with maternal blood may occur during an amniocentesis or early separation of placenta during birth. E. Kernicterus is a potentially serious effect due to pathological jaundice that can have long-lasting neurological effects on the child if not prevented. The answer is C. A major effect of Rh incompatibility is an increased risk of blood clotting and thrombosis in the fetus during subsequent pregnancies. Blood clots are not a common effect in the fetus due to Rh incompatibility. A disorder known as erythroblastosis fetalis is a type of hemolytic disease that occurs in the fetus due to an immune reaction of the Rh-negative mother in an Rh-positive fetus. All other choices are associated with this type of incompatibility. Which type of abortion is associated with sepsis, cramping, abdominal tenderness and an open cervical loss? A. Threatened abortion. B. Spontaneous abortion. C. Inevitable abortion. D. Complete abortion. E. Missed abortion. The answer is E. Missed abortion. A missed abortion is marked by the death of the fetus in utero but is not expelled from the uterus. If left untreated can lead to infection in the womb. It is marked by foul odor and bleeding as well as an elevated temperature and sepsis. Which of the following statements is true about a high-data-deformed molar pregnancy? A. A molar pregnancy is a type of ectopic pregnancy in need of dilation and curettage to prevent internal hemorrhaging or possible hysterectomy. B. An ultrasound usually reveals a mass resembling a cluster of grapes, and a blood test will reveal a positive pregnancy result due to elevated HCG, human chorionic gonadotropin, hormone. C. The cause of a molar pregnancy is due multiple ovum becoming fertilized and coalescing to form a cluster of atypical cells containing a haploid number of chromosomes. D. A molar pregnancy can proceed without incident once Rho immune globulin is administered to the E. A high-data-deformed molar pregnancy is reported to cause malignancy in approximately 60% of cases. The answer is B. An ultrasound usually reveals a mass resembling a cluster of grapes, and a blood test will reveal a positive pregnancy result due to elevated HCG, human chorionic gonadotropin, hormone. A high-data-deformed molar pregnancy is mostly a benign process that may occur due to an abnormal ovum becoming fertilized and growing into collection of cells in a cluster-like formation. They are benign over 80% of the time. Rho immune globulin is a medication administered to an Rh-negative mother that will give birth to a second Rh-positive child to prevent an immune reaction that may harm the child. A woman is hospitalized for preeclampsia. Which medication may the nurse administer to prevent the occurrence of seizures? A. Calcium gluconate. B. Zolpidem. C. Pitocin. D. Nubane. E. Magnesium sulfate. The answer is E. Magnesium sulfate. Magnesium sulfate is used to prevent seizures in women with severe preeclampsia. Calcium gluconate is the antidote if magnesium toxicity is assessed. It should be readily available when a woman is receiving magnesium sulfate. Pitocin is used to stimulate the uterus, often to induce labor. Nubain is an opiate that can be given to women during labor to treat pain. Zolpidem, Ambien, is a sleep aid. Jean is a 33-year-old woman who has previously had regular periods but has not gotten her period for 6 months. Which of the following would the nurse rule out as the cause? A. Cross-country running 5 times per week. B. Poor eating habits. C. Yoga once per week. D. Kidney disease. E. Antidepressant use. The answer is C. Yoga once per week. Yoga once per week, light exercise, is the least likely of the above to cause a change in regular menstruation. Cross-country or long-distance running, vigorous exercise, is more likely to cause changes to a woman's cycle. Poor lifestyle choices such as eating habits and health issues such as kidney disease can also cause irregular menstruation. Likewise, pharmaceuticals can have the same effect. Sandy is 29 years old and experiences bleeding between periods. The nurse marks which of the following on Sandy's medical chart? A. Metorrhagia. B. Menorrhagia. C. Menomtorrhagia. D. Polymenorrhea. E. Oligomenorrhea. The answer is A. Metorrhagia. Metorrhagia is bleeding between periods. Menorrhagia refers to excessively heavy periods. Oligomenorrhea refers to light, scattered periods, typically spaced by greater than 35 days. Polymenorrhea is used to describe short cycles of equal to or less than 21 days. Menomtorrhagia is used to describe periods that are heavier, sporadic, and more frequent than normal periods. A patient tells the nurse that she is practicing fertility awareness. The nurse tells the patient that the unsafe period can range from A. 2 days before and 1 day after ovulation. B. 7 days before and 7 days after ovulation. C. 2 days before and 2 days after ovulation. D. 1 day before and 1 day after ovulation. E. 1 day before and 2 days after ovulation. The answer is B. 7 days before and 7 days after ovulation. According to the family planning method of contraception, the period in which conception can occur and one should refrain from intercourse is up to 7 days before and 7 days after ovulation. Some references show that sperm can live for up to 5 to 7 days inside the female reproductive system. An unfertilized egg can live from between 12 to 24 hours. This greatly increases the window in which conception can occur. Which of the following is false regarding oral contraceptives? A. They may reduce the risk of uterine cancer. B. They may heighten the risk of depression. C. They may decrease the risk of breast cancer. D. They may increase the risk of developing a blood clot. E. They may decrease the severity of menstrual cramps. The answer is C. They may decrease the risk of breast cancer. Oral contraceptives may increase the risk of breast cancer, increase the risk of depression, and increase the risk of developing a blood clot, higher in women who smoke cigarettes. They can reduce the risk of uterine cancer and are frequently used in women with primary dysmenorrhea. Primary dysmenorrhea refers to painful menstrual cycles without an underlying cause. A 51-year-old female arrives at her doctor's office because she has not had any periods for 12 months. The nurse should suspect A. Pelvic inflammatory disease. B. Endometriosis. C. Menopause. D. Polycystic ovarian syndrome. E. Pregnancy. The answer is C. Menopause. Amenorrhea is the complete absence of a period. There are many different causes for amenorrhea. One of the most frequent causes of amenorrhea for women in the 5th decade of life is menopause. Menopause is the most likely cause of amenorrhea in this particular patient because she has not been experiencing periods for 12 months and is 51 years old. While pregnancy is possible, the nurse would suspect menopause first. Pelvic inflammatory disease, PID, is a pelvic infection usually resulting in severe pain. Endometriosis is a condition in which uterine tissue inappropriately grows in areas such as the rectum or ovary, also typically causing severe pain. Polycystic ovarian syndrome is a condition causing hormone imbalance. It can cause amenorrhea. Jody is a 40-year-old woman seeking care for dysmenorrhea for the first time. Which would not be considered an appropriate treatment? A. Oxycodone, acetaminophen. B. Naproxen. C. Oral contraceptives. D. Ibuprofen. E. Lifestyle modifications. The answer is A. Oxycodone, acetaminophen. There are many different ways to treat painful periods, dysmenorrhea. Ibuprofen and naproxen are anti-inflammatory agents that do not require a prescription and can be very effective. They have relatively few side effects. Lifestyle modification, such as exercise, is another good alternative. The use of oral contraceptives are also frequently used to give women lighter and milder periods. Percocet is not generally used because it is an opiate analgesic and not recommended for long-term use because they carry potential for addiction.